Welcome to this short video in the 5-minute supervision series. My name is Matthew Links and I'm the discipline lead in medicine here at Bond University. I'm speaking to you from the land of the Kombumerri people on the Gold Coast. Today I want to talk about teaching to the curriculum. By this I mean, how do you make decisions on what you're going to teach and how it aligns with the curriculum? This is a topic that causes some stress to supervisors, so today I'm going to share an overall approach, keeping it simple. The term curriculum is used pretty loosely, so let's look at some definitions. Often people are really talking about a syllabus, which is a list of what is taught. The curriculum actually refers to the whole thing, about the what is taught, how it's taught, and how it's assessed. When people publish a curriculum, there are different ways to define the outcome, which leads to different lists. You can focus on what is learnt, the learning outcomes, what skills are achieved, they're broken down into a list, or you can put the skills back together again and focus on the tasks, such as trustable professional activities or EPAs. The whole problem is that practice is messy, chaotic and random, so connecting what happens on placement to the list is always a challenge. Now it gets more complicated when we think about what's been termed the hidden curriculum. What students learn has a lot more to do with how we behave and the choices we make than what we say. What we explicitly teach is just the tip of the iceberg. We might talk about teamwork, but then not involve the nurses in our care, and you can predict which message is really going to be taken home. One way of dividing up the curriculum is into domains. The Australian Medical Council has defined 4 domains: scholar, professional, advocate and practitioner. On clinical placements, we tend to think about educating students as practitioners, but it's important to remember that students also need to learn the scholarship of medicine. The most difficult parts of the curriculum to make sure we teach in clinical placements are teaching about health and society, prevention, promotion, public health, global health, indeed planetary health, which I've called the advocate role. These are important to how we practice, but they're hard to teach. Similarly, teaching professionalism can be hard. The tendency is to focus on clinical skills, and this sends a message that the other domains are not important. So we have a problem. The curriculum's huge, so the task is endless. Clinical practice doesn't align neatly with the list. You can't teach everything, so you have to make choices, and what we choose sends messages. And another aspect is if we make students responsible for their own learning, the problem is that they don't know what they don't know. So here are some strategies. We just have to do our best in a complex situation. The first message is relax. It's not your responsibility to teach the students everything about cardiology on their cardiology rotation, for example. Students are responsible for their own learning. You should be a guide on the side. Now, curricular frameworks do help, and amongst all the complexity, my approach is to focus on key clinical tasks, or EPAs. These are a shortcut to using intern readiness as a goal. The final strategy, amongst all the things you can teach, is that you have to meet the students where they're at and adapt. You might plan to teach them breaking bad news, but if they can't have a simple conversation with a patient, you'll need to adapt. Lists of key clinical tasks or entrustable professional activities are a good guide to what you can teach. On the left-hand side of this column, I've listed the American 13 EPAs. Key clinical tasks such as assessing by doing a history and physical examination, questioning by forming clinical questions and retrieving evidence to advance patient care. Have a look at the list and see which of those do you teach, which ones are missing, and which ones do you think you could prioritise. In the right-hand column, I've shown the way that the American EPAs have been bundled together to create 4 more complicated EPAs in the Australian Medical Council system. and then also that there are some key tasks that aren't covered by the Australian standards. So how do you prioritise when there are so many important topics? Firstly, you should teach to opportunity. If you have a specialist practice in interventional cardiology, this is an opportunity for a deep dive, and there should be lots of murmurs. Teach also to your passion. If you're passionate about equity, diversity and inclusion in medicine, go for it. Take the opportunity. We all have different passions, and students will be exposed to different clinicians, see a variety of perspectives, and hopefully it all evens out in the end. Teach also to your values. Think about what you value and promote it. If you have a specialised practice, that's okay, but consider teaching generalizable values. If you spend all day consenting patients for cancer immunotherapy, that's fine, but I would focus on the principles of good consent. If you know your students, and if you ask them, you can teach the students gaps. Perhaps they did a lot of acute coronary artery syndromes in their ED term, but they've never seen a person with valvular heart disease. Teach to the whole curriculum. To teach about access to care, you could discuss how access to interventional cardiology is unequally distributed and how this is a problem for remote communities. You can apply a social determinants of health lens or a professionalism lens to many of the patients we see. When thinking about prioritising, prioritise safety. If a problem is an important quality and safety issue for interns or the community, then it should be taught. Prioritise the parts of the curriculum that are hard to learn. First Nations health is a good example. If you have an Indigenous patient on the ward, then this is an opportunity. Grab it. If there's an opportunity to teach self-care, grab it. Finally, use intern readiness as a guide. The curriculum is also about how you teach, and it's worth reflecting on how you teach. It's better to use methods that empower students to learn for themselves. Lecturing is easy, makes us feel knowledgeable, but better learning comes from promoting and guiding self-directed learning. Allocate tasks that are of value for the team and for the student. Promote small amounts of good quality feedback often, and use methods that themselves promote good practice, like team-based and interprofessional learning. And remember that you're always role modelling. So to summarise, relax. You're not responsible for teaching the student everything. Be a guide, be yourself, prioritise, fill gaps, think about the big picture, reflect on your teaching experience and get feedback, and focus on intern readiness. I hope you enjoyed this video and are inspired to learn more about teaching to the curriculum. You may find other lectures in this series helpful on YouTube or Vimeo. I've provided some links to key curriculum standards, and if you found this video helpful, please like it or leave a comment, a suggestion for improvement or a request for further content. Good luck and enjoy teaching to the curriculum.